This is happening all across the country. Hospitals in Chicago, LA, and Washington, D.C. have had to make that change, and now it's hitting Connecticut. People have been divided on gender affirming care for kids for years. This care can include mental health and medical services to support a person's gender identity when it's different from the sex they were assigned at birth. One of those services is puberty blockers and hormone therapy. The program at Connecticut Children's does offer that for those who have reached puberty.
I've been talking with families nonstop the past 48 hours. Um, Myself and a team of other leaders of some organizations, and um, we're experiencing the emotions run the gamut. Some parents cried, of course, that they're very concerned about their children. Gender affirming care is evidence-based, it's medically necessary, and it is legally protected in the state of Connecticut. And we hope elected officials will step in and help our families with this situation because it is dire.
But that treatment is controversial, and now hospitals around the country are pulling back or closing their gender care services for minors after increased federal pressure and ongoing legal uncertainty. In the last hour, we heard from Attorney General William Tong. In a statement, he says, quote, "This is about scaring patients from seeking care and scaring doctors from providing care, regardless of who is harmed and the lives that will be lost. It's unconscionably reckless and yet another disturbing intrusion of partisan politics on our private lives and choices." We heard from Governor Ned Lamont. He says, quote, "These decisions are not based on Connecticut values or Connecticut law. They're part of a series of relentless federal demands that have created fear, confusion, and legal uncertainty for our healthcare providers," end quote. The governor also tells us he is working closely with Attorney General Tong and hospital leaders to understand the full impact of this decision. Connecticut Children's has not given a timeline for when their services will fully stop, but a spokesperson says that every single child's needs will be handled case by case. And we will continue to follow the story as it develops, of course, here in Connecticut and nationally. Reporting in Hartford, Priscilla Meza, Fox 61.